Hello, everyone. I hope all of you are safe in your homes and doing well. In these corona times, that's the best that we can hope for. But welcome to another edition of Ask Advancells. My name is Vipul Jain. I'm the founder and CEO of Advancells. And as you all know, that with the series of video messages, we try to educate our patients, our partners, people who usually follow us for some sane medical advice on different topics. And this is your chance to ask any questions that you might have regarding the topics or in general, and we'll be more than happy to answer them at your convenience. Today, we decided to talk a little bit about a very important topic, management of diabetes during the times of COVID-19. As you all must have heard on the news, read in the papers, several WhatsApp messages, there is a direct correlation between deaths that are happening because of coronavirus and comorbidities, in which hypertension and diabetes range almost at the top, which means that people who have pre-existing conditions such as diabetes and hypertension there is higher mortality rate between among those set of patients when it comes to COVID-19 versus the people who do not have such underlying conditions already. Which basically means that people who are diabetic, people who have higher blood pressures, or people who have pre-existing medical conditions have to take a much more precaution, have to take much more effort in taking care of themselves, and so do their families, and so do their caregivers, and so do people around them. It is very, very important for them to follow certain set of practices to make sure that they do not get affected with COVID-19 and thus are able to sail through these times without much problems. So what is it that you can really do if you are a diabetic in such situations? Well, the best answer is stay indoors, stay at home, do not get out unless and until if it's a real emergency, and just stay safe. That is the best that you can do. However, if you are diabetic, you do understand that you need to consult your doctor regularly. You need to make sure that your tests are done regularly, and all those medical precautions that you have been taking all this while must be done even during these periods as well. Most of the doctors, as we all know, are now available online, are available via teleconferencing. So it is very, very important that you talk to your doctor and make sure that how you connect with them in teleconferencing, over Zoom calls, over WhatsApp calls, whatever the preferred way of connecting the two of you are. Most of the doctors are now doing these kind of online consults, and there are several ways in which they can check you, they can examine you, take care of you, read your vitals, and all those things. Technology has grown a lot, and please make use of that technology. So connect with your doctors online. Since the time we are all in lockdown, cooking has become a favorite hobby for pretty much everyone. And wherever I see, whoever I talk to, everybody is making exotic foods and desserts, and trying their hands on cooking different kind of cuisines. But being a diabetic, that does not give you a free license to eat anything that you want. These are the times when you really have to restrain and make sure that you are eating healthy, you are eating the right things, you are not eating anything which can spiral your diabetes out of control. Because remember, these are challenging times, and if you do not take care of your diet, you probably will have a lot of difficulty getting to a doctor, getting to a hospital, and really you don't want to go to a hospital during these times, because hospitals are dealing with a larger problem of COVID-19 at this time. So we have to make sure that we have to take care of our diet properly. Exercising. A lot of us are not able to go out of our homes. In fact, any of us are not able to go out of our homes. So going for a walk in the park, going to jog in the joggers park, going to the gym, going outside just to do some physical activity is all non-existent. So what do? Since we are at home, we are not able to do a lot of physical activity, which, as you all know, directly correlates to diabetes levels. So since we have got much more options to eat, we have got much less options to do physical activity, we go into a spiral where diabetes can really go out of control. So we really need to be very, very mindful of these two things. Make sure that we are eating healthy, make sure we are getting some kind of exercise. And there are several home exercise routines that you can easily get on the net, simple basic things, making use of home furniture and getting that half an hour, 40 minutes of exercise every day. So having healthy food, exercising regularly are two most important things that diabetic people can do during this COVID era. I'm pretty sure that we are pretty much in the last leg of lockdown, but that does not mean that very soon we'll have a license to go all out and to resume activities as normal. We are all staring at a new normal. How it will be is still to be panned out, but one thing is for sure, that staying home, staying safe is going to be the mantra for a long, long time. So do take care of yourself. Do let us know that if you have any questions, and we'll be very happy to help. And we hope to see you very soon in our next episode of Ask Advancells. Till then, take care and goodbye.